Hey, doctors. I want to talk to you today about a concept that I've discussed with a lot of doctors over the years. Well, are you, do you do conservative dentistry or aggressive dentistry, right? And I have yet to meet a doctor that goes, "Oh man, aggressive. I love doing all that unnecessary treatment. That really gets me going. Is to just cut teeth that don't need to be cut." Rephrase your thinking about how you approach treatment planning patients. Let's think about conservative dentistry versus definitive dentistry. So let me define what that means. This is, doing the very least amount required to get the job done. So, if it can be solved with a four surface filling versus a crown, well, you know what? I remove less natural tooth structure with a four surface filling, so that's what I'm going to do rather than doing the crown. Definitive dentistry, I always kind of explain it like this. Doctor, I want you to imagine that your patient is going into the jungle on a mission trip into the jungle for the next 6 months. There will be no dentist there. They leave tonight or as soon as your treatment is done. They're on a plane. They're going to the middle of the jungle. This patient wants to make sure they're not going to have any sort of problems during that time that they're out there. Okay. That is definitive dentistry. Okay. I'm going to use an analogy. All right. Imagine that instead of doctors, imagine that I'm an auto mechanic. I'm in the shop every day. And so you bring me your car and I take a look under the hood. I go up, it's your spark plugs, right? And I go, okay, great. You've got 8 spark plugs in this thing. And I look at them, I go, you know what? 3 of these things are completely shot. That's why your car died on the road. So, if you'd like, what I could do is I could replace these 3. You got a few other ones that are kind of near the end of life, but they're okay. And then you got 2 more that are kind of in the middle range. And so I could do is so let's just replace these 3 spark plugs. So then I go in, you're like, okay, I don't even know what you're talking about. So have at it, right? So, okay, I go in and I replace the spark plugs, and then you're back out on the road again. And then 2 months later, your car breaks down on the freeway again. And you're like, what in the hell? I just had this thing fixed. What's going on? You bring it back to me. I go, oh, you know what? 2 more of your spark plugs went bad. So we can replace those. Right? And I replace those. Then you're back out on the road. 3 months later, you're dead on the freeway again. I mean, by the 3rd time, you're going to be like, okay, forget this guy. I'm going to go to a different shop. Go to the different shop. He looks at it and goes, yeah, dude, we got to just replace your spark plugs. They're starting to go bad. We got to just replace these things. He replaces your spark plugs. You're out on the road. No future problems. From a auto mechanic perspective, if I'm an auto mechanic, I'm in the shop every day. It's no big deal to me. I bring my car in. If I have work on my own car, I'm going to do the very minimum required. I'll replace those spark plugs one at a time. I'll file the rust off of them, maybe get a couple thousand miles out of them. From your perspective, as a person that owns a car and drives it, that is horrible. You do not want that. You do not want to break down on the freeway. You just want, so it's an extra $400, $500 to get all your spark plugs replaced when 1 or 2 of them might actually still have some useful. Who cares? Just replace my damn spark plugs and get me on the road. I do not want to break down on the freeway again, right? So our dental patients are exactly the same way. For us, it's totally normal to be in the dental office. We're here every day. We work here, right? So for us, if we're like, oh, we can just try, see if this works. And if it doesn't, then we'll move on to the next thing. And if that doesn't work, then we'll, have you come back and we'll move on to the next thing. For the dental patient, however, this is horrible. They do not want to come back here. They are nervous as all get out. The anxiety level for them to have to come into the dental office, it is through the roof. It's like public speaking for people, right? That's public speaking, the dentist, and death. I think those are like the 3 things that people are most afraid of, right? And so we don't want to put the patients in a situation where they're having to continually come back, right? 1, they don't like it from an anxiety. 2, they don't like it from this is disrupting my life. I'm having to take time off work and, or school or whatever else it is that I've got going in my life to go in to see the dentist. And 3rd, it reflects poorly on the judgment. We get lots and lots of Yelp reviews, and I read them. And a lot of the negative Yelp reviews is very interesting. What the review was, it said, I had a filling that I had done several years ago. It had fallen off. And I went in to go see one of our doctors here at Gold Coast Dental. And the doctor basically then replaced the filling, okay? And this was a large filling. Patient left. 2 weeks later, patient had pain in the tooth and had a problem with it. Didn't understand what the heck had happened because I just went to the dentist. Why am I having pain? went to a different dentist. And of course, that dentist looked at it and goes, this is a root canal buildup and crown. Any day of the week, they did the root canal buildup and crown. So you have to think about this. And loved that dentist and gave us a 1-star review because they thought this doctor had no idea what they're doing. So you got to think about this. We did a $200 Superman filling, be conservative to save this patient's tooth. Another doctor did a root canal buildup and crown for $2,000. We got a 1-star review. The patient thinks we're, idiots and thieves. The other doctor gets a 5-star review and the patient thinks they're the best thing ever. I see this all the time. To do this Superman dentistry and trying to do this like minimally invasive, cut as least tooth structure as possible, which is an admirable goal. Like I don't want the auto mechanic changing my transmission if it doesn't need to be changed. But when a tooth needs, to be worked on, you need to weigh conservative versus definitive treatment options, not conservative versus aggressive, which nobody wants to be.